Concerns about semen volume and the desire to increase it are common among men, often fueled by unrealistic portrayals in adult media and misconceptions about what constitutes normal. While ejaculate volume can vary widely between individuals and even between different ejaculations in the same person, the average range of 1 to 5 milliliters is usually sufficient for fertility and sexual satisfaction. It is important to remember that quantity alone does not determine reproductive potential. Sperm count, motility, and morphology are far more relevant to conception, and the aesthetic of volume is largely personal. Healthy semen production relies on the coordinated function of several glands and organs. The prostate contributes prostatic fluid rich in enzymes that liquefy semen. The seminal vesicles provide fructose and prostaglandins to nourish sperm and facilitate uterine contractions. The bulbourethral glands secrete mucus that neutralizes the urethra, and the testicles produce sperm and testosterone. Ensuring these structures are well supplied with nutrients and free from inflammation is the core of supporting semen volume. Hydration is the most straightforward way to support semen production. Seminal fluid is primarily water. Chronic dehydration reduces total body fluid and can lead to lower ejaculate volume. Aim for 2 to 3 liters of water daily, more if you are physically active or live in a hot climate. Watch urine color as a simple indicator. Pale yellow signifies adequate hydration, while darker urine suggests the need for more fluids. Moderating beverages with diuretic properties such as coffee and alcoholic drinks will also help maintain hydration. Smoking cessation is another critical factor. Tobacco smoke introduces reactive chemicals that increase oxidative stress and inflammation within the reproductive tract. Numerous studies have linked smoking with reduced semen volume, lower sperm counts, poor motility, and increased DNA fragmentation in sperm. Quitting smoking can improve semen parameters within months and benefits overall vascular health and erectile function. Similarly, limiting exposure to environmental toxins such as endocrine-disrupting chemicals found in some plastics and pesticides protects hormonal balance. Allowing adequate recovery time between ejaculations can also modestly increase semen volume. Semen is generated continuously, but the accessory glands need time, often 48 to 72 hours, to replenish fluids fully. Frequent ejaculation reduces volume not because of a health problem, but because the glands have not had sufficient time to restock. This does not mean that frequent sex or masturbation is unhealthy. Rather, men concerned about volume can experiment with longer intervals and see if they notice a difference. Strengthening pelvic floor muscles through targeted exercises can improve the force and control of ejaculation, which in turn may influence perceived volume. The muscles of the pelvic floor support the bladder and reproductive organs. When they contract during ejaculation, they help propel semen. Kegel exercises involve contracting and holding the same muscles used to stop urine flow. Begin by performing 3 sets of 10 contractions daily, holding each for a few seconds and gradually increasing the duration as strength improves. A well-trained pelvic floor can also enhance erectile firmness and orgasm intensity. Nutritional balance is integral to reproductive health. Diets rich in whole grains, lean protein, healthy fats, fruits, and vegetables provide the vitamins and minerals needed for sperm production and hormonal regulation. Zinc, selenium, vitamin C, vitamin E, and folate are particularly important for sperm health. However, supplementation should only be undertaken under medical supervision. Taking megadoses of vitamins or minerals without documented deficiencies can be ineffective or harmful. For example, excessive zinc intake can interfere with copper absorption and lead to gastrointestinal discomfort. Medical therapies such as testosterone replacement or drugs that modify prolactin or thyroid levels should only be used when clinically indicated. Low testosterone, hypothyroidism, and hyperprolactinemia can negatively affect semen volume and should be diagnosed by blood tests. Self-prescribing hormones or unregulated supplements can disrupt your endocrine system, leading to reduced fertility and other health complications. If you have concerns about your semen volume, speak with a urologist or reproductive endocrinologist who can perform a comprehensive evaluation, including semen analysis, hormonal profiles, and physical examination. Finally, it is important to set realistic expectations. Genetics, age, and general health all influence semen volume. Semen production gradually declines with age, just as other bodily functions do. Rather than fixating on volume alone, focus on overall sexual and reproductive wellness. Maintain a healthy weight, exercise regularly, manage stress, and cultivate positive relationships. If you and your partner are trying to conceive and have been unsuccessful, consult fertility specialists early. Many underlying issues can be treated or managed. Supporting semen health is an extension of supporting your body as a whole. Drink enough water, avoid tobacco and excessive alcohol, eat a balanced diet, allow time between ejaculations when volume matters, strengthen your pelvic floor, and use supplements or medications only when medically advised. Remember that your worth is not measured in milliliters. Be kind to yourself, base your choices on science rather than myths, and work with healthcare professionals when needed. This balanced approach will not only support semen volume, but will also enhance your overall well-being.